mission is to serve the poor, but to serve them with dignity and respect, and to help empower people to help themselves.
As a country, we will have poor, and we will have individuals that will need access to services in any crises given, whether it's in healthcare and in social services.
It is very much a focus of empowering them so that life doesn't just go on as it is, but what can we do to help them so that life gets better for them?
When someone is looking at establishing a business, normally there's a feasibility study. You look at the market demographics, you look at populations, you look at income levels, and you want to put your business in an area where you have it's more likely that you'll succeed. The daughters do exactly the opposite. They look at where there are very few services, where there's very little money, and where there are needs that nobody else is meeting, and that's where they put their facilities.
Sometimes we think that doesn't exist here in San Antonio, being such a big city, or it doesn't happen in the United States because we're one of the wealthiest countries in the world. But even today, we still have families, and these are the families that we serve, families that are living with not having their basic needs met.
It's giving the opportunity to serve people that could otherwise go unserved.
The daughter's mission of providing services, basic services, to the most vulnerable and poor is why we do the work that we do.
We were founded in 1633 in Paris, France, by St. Vincent de Paul and St. Louise de Marillac. From the very beginning, their view was responding to people's needs. And so they did a lot of home care. They visited prisoners. They took in orphans. There were wars and famines, and many children were left on their doorstep, and they had no idea how they were going to get the money to take in these orphans and raise them, but they knew they had to. So that really was the origin and the spirit for our community ever since 1633. Is to assess what do people need that we can work with them to make life better for them. In 1958, 5 sisters came to San Antonio. They wanted to start a clinic, but it took them until spring of '61 before they were able to get the money together in order to build a clinic, have a building, get medical equipment, find a physician, get supplies. And so the El Carmen Clinic actually opened in 1961. They kept growing to take care of not only the medical needs of the people in the area, but then they saw the importance of dental care for the people. Nothing was available for them. And they also looked at the broader picture. At that time, people didn't have electricity in their homes. Many of them didn't have running water. 2 sisters worked for a number of years to petition to get water out into the El Carmen area. So it was looking around to see what needed to happen that would make life better for people.
Today, through our work, we're continuing the legacy of St. Vincent de Paul, St. Louise de Marillac, and St. Elizabeth Ann Seton, as well as the daughters. The compassion, the dedication, the commitment that they've consistently demonstrated have created in me a stronger desire to want to make the difference and to work in the front lines with individuals that are not likely to have access to some of the basic needs that we should all have.
When I started at this organization, I didn't even know this part of San Antonio existed, that there was a community here. And it's a community that is filled with people who have limited options. Some of the clients there said, it is so nice to have a facility like this on the south side.
In South Bexar County, we've identified the needs for medical care, dental care. We have a need for counseling services and social services, as well as just early childhood education. These are services that are not readily available to the population that we serve.
When we see the families and they enroll in our programs, it seems like we are the most stable environment, most consistent, where the children are fed, their basic needs are met, and if their basic needs are met, then they can move on to higher education.
We have a firm commitment to education and to the belief that if you're going to succeed, you need a good education. Not only do we have the children that we can influence, we have their parents and their extended families. So in having social workers available, you can find out what other needs there are in that family. Is someone unemployed? Does someone qualify for services for medical or dental care? Does someone need a referral where they can get some job training? You get engaged with these people and can make a difference so that it's not just in isolated silos.
In social work, what we do is a psychosocial assessment, and that's not only looking at the basic needs, it's also looking at the entire person, the whole person, just as our mission calls us to do, to look at the person in a holistic manner and serve them in a holistic manner, mind, body, soul, and spirit.
We try to meet the patient where they are at and then help them with all aspects of their health care. We're not going to just, here's your diabetes, here's what you need to do, and good luck. Come back in 3 months.
As I think about the future for Daughters of Charity Services of San Antonio, I can't help but think that there will be more individuals in need of our help. And the way that we will be able to address those needs is through partnering with other organizations. And what that means is that we have the opportunity to break the cycle of poverty.
What I see is nothing but opportunity. And that's opportunity to respond to the needs of the community. And that's what has happened, and that's how our program has grown, is that we continue to adjust to meet the needs of the community. And so we are not providing services that Daughters of Charity Services thinks the community needs. We're actually working in partnership with the community members to address the needs that they identify as a need. And so I only see more great things. I think I don't see an end yet, and I think that if Vincent and Louise were alive today, they'd be very proud that we continue to carry out their works in the manner that we do.
Thank you for all the things I got. I really appreciate it a lot. It did help us a lot this year. I can prove it. When my mom got your letter, she wanted to cry because all your help. Love, Jason Martinez.
Thank you very much for giving me and my brothers the school supplies and clothes for school. My mom really appreciates the fact that you are also giving us school clothes and shoes because she doesn't have the money for her to buy me and my brothers all the stuff we need for us. Bye. Esmeralda Lopez.
Hi, my name is Alejandro Cortez. I'm writing this letter to show my feelings of joy and happiness. Thank you so much, Daughters of Charity Services of San Antonio. You are the best, I thought nobody would do this for me, but you did.